Yes, so the APCCC meeting took place this year, so 2022 in April, and we had a lot of questions, almost 200 questions that we sent via a survey, like web-based survey, to more than 100 experts, or clinical experts for prostate cancer. And we discussed at the conference the topics, but also some of the results that came out of these votings. So the votings are all about really areas where we don't have strong evidence. So it's really like these gray areas where there's a lot of discussion ongoing. And I just picked some because obviously with 200 questions, it's a lot of these areas. So one of the areas was actually the novels like next generation imaging with PSMA-PET CT to understand when the panelists would use an PSMA-PET CT, for example, in the setting of staging of high risk or intermediate risk patients. So there was a clear consensus, and consensus is defined by 75% or more of the panelists voting for the same answer option, that in high risk patients it should be done, even if not everyone is like really saying yes, we should do that. So Pete Ost today was quite clear he would not do it, but there was a consensus to do it in the high risk patients, and there was consensus to not do it in the intermediate favorable patients, and there was like at the APCC about half of the panelists voting for doing it in the intermediate unfavorable patients, and the other half not. So it's just showing a bit that we are kind of struggling with this really like kind of more accurate imaging for staging. But since sometimes it's difficult to understand what you should change, or if you should change the management of your patients based on the findings, there's always a lot of discussion ongoing. Should we use it or not? And another very interesting topic is for which patients would you do adjuvant radiotherapy versus early salvage radiotherapy? And again, I mean, it was interesting. So I don't want to go too much into details, but it seems that adjuvant radiotherapy is not completely gone, even if we have 3 big trials showing that probably early salvage, really early salvage, is as good as adjuvant. But we have to consider that in these trials, we had a very small percentage of really high-risk patients included. So that was quite some discussion about that topic. And then we had obviously quite an interesting discussion about metastatic hormone-sensitive disease, when to use triplets. I guess that's also really something we are all kind of struggling with. I mean, we have this nice good data showing now that addition of a novel endocrine agent to ADT plus docetaxel gives a survival benefit. Question is who should get it, and we're going to talk about that later. But maybe also who should not get it. So that was something we discussed at APCCC, and we had quite interesting results. And we asked the same or very similar question already in 2021 in October. And just interesting already that there is already a change in the minds of the panelists in that kind of short time, right, 6 months, in the sense that more panelists would vote for the triplet therapy in patients with high volume disease. So I think there's a lot of dynamic in all that fields right now.